Can I give you a couple of examples, or maybe one example? For example, okay, a young child. Now let's see how this fits into dentistry. A young child is weaned and begins drinking cow's milk. No big deal, except the child's allergic to cow's milk. So now they develop an allergic type reaction, have difficulty breathing through their nose, so they start breathing through their mouth. When you breathe through your mouth instead of your nose, the air you're breathing, which is basically dirty air, is unfiltered, which is what your nose does exquisitely. When it's coming into your mouth that way, the first thing it runs into is your tonsils, which it's going to engage with and cause inflammation. So now you've got swollen tonsils, can't breathe through your nose because of this allergy to milk. Now the child starts grinding their teeth, snoring at night, airway problems. They could even develop sleep apnea, where they stop breathing for periods of time. But also, it affects things like a 3 or 4 or 5-year-old now still bedwetting. They're having problems cognitively. They're starting to go to school, but they can't learn their ABCs. The teacher comes to the parents and says, I think your child has ADD. And they may even be diagnosed with that. Now they're going to be given amphetamines to solve their problem, which is really an allergic, breathing, sleep problem that could easily be reversed in a matter of a few months back to a totally normal child, which this child may never be. Less than 15% of children in that category are even being screened. We can easily screen that. They're also going to develop different occlusions because their tongue's going to stay in the floor of their mouth, their upper arch won't develop, they may end up with a narrow upper arch, cross bites, crowded teeth. So we can see things going on in their mouth that are reflective of that. A lot of these children may have tongue tie, so their tongue isn't as mobile, and that affects their breathing and swallowing and function as well. So that's one example. Dentistry being involved in treating and identifying the child with potentially ADD. Young adult women, I call them young fit females, you know, so they come into our office saying, my jaw hurts, my jaw's tired, I'm getting headaches, I wake up in the morning, I've been clenching and grinding, and we say, oh, you've got TMJ. So we make them a splint, but we really haven't diagnosed them. And very often we're finding these are also people who may have sleep difficulties. They're not getting airway, transferred as well as they could. So they're having a lot of effort in their sleep to breathe properly. They may even develop obstructive sleep apnea, maybe not, but very rarely diagnosed. And yet, if that were addressed, very often you could reverse the so-called TMD problem. And then you have the fat old men, the older guys that are the classic big neck, couch potato, beer in hand, watching the game with chips. And they snore loudly and they're foggy mentally and all that, and they've got obstructive sleep apnea. Very few of these, over 30 million people in the United States, are even being screened, less than 15%, much less treated. And dentistry is sitting right there looking at all this if we understand it and we know what to do about it. Nutrition's another subject. I could go on and on with the different aspects of the overlays of how our lifestyle and the things that affect our lives can influence our health, but also it's sitting right there, right in the oral cavity, right where we work, and we can see it. We spend more time with patients than anybody else in the medical field. We should be the leaders as the gatekeepers of total health in dentistry. We can do that through the training we can do through AES.